gained from viewing the following program is not a substitute for regular exams by your physician and does not constitute a doctor-patient relationship. All information gained should be discussed and confirmed by your physician.
Hello, welcome to Healthy, Wealthy, and Wise. We're so glad you joined us today. We hope that you, as you listen to this program, will find many tips to keep you healthy, wealthy, and wise. I'd like to make a suggestion. If you get something to write with, a pen and paper, you may find some things you'd like to note that will be of help to you in the coming days to keep you in good health. Today our guest is Mickey Ask. Dr. Ask is a faculty member at Loma Linda University School of Medicine, Department of Internal Medicine, and Preventive Medicine. He's the Director of Addiction Medicine at the VA hospital here and is very knowledgeable in how to deal with some of these problems of addiction, not just alcohol, which we're going to discuss today, but other kinds of addiction which we will touch on to some degree. Today we want to ask the question, how much alcohol is too much? And Mickey, we keep hearing about all these things about alcohol being a little good for you, and why is it so socially acceptable, and where are the limits?
Well, one, I think it's the physiologic, pharmacologic effect that alcohol has on our brain. It does have a relaxant effect, and so if a person is in a state of anxiety or even feeling a little more relaxed, we probably all we wouldn't mind that, put it that way. So there's that effect of alcohol, I think, taps into this. A lot of us are always looking for a quick way to feel better, so alcohol certainly acts quick. It's not enough to kill us right off, so we get by with continuing to repeat it.
Reminds me of that Bible text, because judgment against a wicked act is not executed speedily, therefore the hearts of men are fully set on them to do wrong.
So it creates an illusion that we're getting away with it. It helps us forget the negative aspects, but I think the real issue is that it's really a parasite that taps into our God-given, created, natural reward pathway. So you could question, well, why is there a system that responds to heroin and alcohol and marijuana and cocaine and speed? Why is there a system built into our brains that responds to that? Why would God create us that way? Well, the reward system is there so that when I do something right, I get a little buzz out of it. So God rewards me by giving me a little endorphin rush. So I study hard, I get a good grade, and I get that A or B back, and I get this little pleasurable feeling, and I start thinking, now, that feels pretty good. How did I get to this point? Oh yeah, I put in the time and I studied. Well, let me do that again so that I can feel that way again.
Is that the same thing with exercise?
So exercise, when we treat other people well and they respond to us in a way that makes us feel good, we say, wow, that feels great, that relationship feels good. Now, how did I get that response? Oh, I was polite, I didn't interrupt, I didn't insist on my own way, I did something nice for that person. Let me do that again. The problem is when we hijack the system, bypass the footwork, and get that feeling, then we remember that and we say, oh, I'm going to take that drink again, I'm going to take that hit again, and then that's what we're going for instead of doing these other things. So that's how I think it starts, why we even have these drugs and why we even use them in the first place.
What does one drink a day mean?
So when a person says, oh, I just have a drink a day. I had one person that said that, and as the medical student pursued the history after I taught him how to do that, it came to be that he was drinking a 60-ounce drink or a 40-ounce drink. Well, that's just one.
Just one.
So when we use the term clinically, what we mean is one 12-ounce can of beer has about 5% ethanol, is equivalent to about 5 to 6 ounces of wine, which ranges from about 10, 12% to upper limit of about 22% concentration of ethanol. So it's more concentrated, so therefore you don't need as much of the liquid to get the same effect. And then that's equal to about an ounce, give or take a little bit less or a little bit more, an ounce of liquor, which can be an 80 proof drink is actually a 40% ethanol, up to some of the rums and so forth. When you see 150 proof, that'd be like 75%. So when we say a drink, then that's what we're trying to figure out is those equivalents. Each drink affects your blood alcohol level at, so the reason it was set at that is because each of those affects the blood alcohol level the same. And most states now have a legal limit equivalent to about 4 drinks. So each drink is about 0.02, and the legal limit is generally 0.08. So it only takes a few drinks then to get up to that level.
So we keep hearing that 1 to 2 drinks is good for your health, and then we see the differences in the levels of beer and wine and hard liquor. So how does one interpret all of that and think about, okay, 1 to 2 drinks, 1 to 2 drinks of what is good for me? We hear beer sometimes, we hear wine sometimes.
So it's probably about the same. I think the studies have been done that show, first we said, you know, or not we, but the literature seemed to, that red wine was more healthy, and I think they've now expanded that to wine in general, and when maybe it's the wine because of grapes versus grain. I don't think that there's substantial differences in those statistics depending on the beverage.
Yeah, some of the things that I've read recently would indicate that the source of alcohol doesn't make any difference, whether it's the wine, of course, if it's from the red wine has some of the antioxidants the grape juice has, and so they advertise that, and that's true. But alcohol does seem to have an effect on improving lifespan. But the thing that bothers me about that is that they don't tell you about all the other things that can happen. And I see these definitions, the NIH group, the Alcoholism Abuse and Alcoholism Center at NIH, has said that any more than 2 drinks a day, we're talking about any one of those 3 you described, any more than that puts you at risk. So tell us a little bit about that and why these limits that we hear that are supposed to be helpful for you really may not be.
Well, let's back up to why are they even saying this in the first place? Is that when we look at all the things that people die from, all-cause mortality, there's a J-shaped or U-shaped curve, so that at the people that don't drink at all, there's a certain mortality, certain death rate, and then you go to the ones that drink a few drinks, 1 or 2, or some alcohol, we'll say it that way, have actually a lower mortality. And then as you get beyond a few, then there's a dose-response relationship, so that the more you drink, the more problems you have. So this lowest mortality at a little bit of alcohol is where all this started from. So that has been a repeated finding. So now the question is it the alcohol or is it something else? And that has not been determined. We do not know if it's the alcohol or if it's something else.
What could be the something else that might make these people live just a little longer? And we're talking about mortality here only. We're not talking about diseases and time in the hospital and what we call morbidity, illnesses of various types, or any of the social effects. We're just talking about the mortality part.
So we have to even back up that, is that a real, there's even questions about what I just said, though, if that's a real finding or not, because some of the people who aren't drinking at all doesn't mean that they never drank in their life. In fact, they could be very heavy drinkers or alcoholics who now realize that they shouldn't drink, and so now when they began the study, they're actually in the abstinent group.
Oh, fascinating.
The other thing is that people change, and so if you started off as, you can change groups, so if you started drinking a little bit, again, for the same reason, you might have stopped because of a medical problem, and so now that puts you in the abstinent category. So the other thing is that moderate drinkers, and even moderate has to be defined, some studies have seen an effect just from 1 drink a month or 1 drink a week. So it's clearly some other things. So a person who might be considered a moderate drinker might be more healthy in other areas of their life. They might not be as overweight, they might exercise more, they might not smoke, they might eat healthier, and so forth. So some of the findings, like in the French studies, this French paradox, the ones that drink a little bit of wine are out living more healthful lifestyles in general. So there's lots of different factors that need to be considered, and I think it's bad advice still to advise somebody to use alcohol. In fact, I've had some patients who have come in that did not drink, doctor advised them to drink, and now I'm treating them as an alcoholic.
So we do have to be careful about statistics, don't we? Somebody said that there's lies, damn lies in statistics.
Yep.
And
to always interpret it correctly.
It's tough to interpret some of these things. And I understand also that there may be different socioeconomic or educational levels that really haven't been always identified in these groups. So there's just scores of variables that have to be looked at before one can make a final conclusion and say, hey, this alcohol is a good thing for you. And one of the caveats that we always see at the end of these reports, at least in print, you don't always hear them on the media and the TV, but one of the caveats is if you don't drink, don't start. In other words, alcohol may help some people out, but it's not such a good thing that everybody better drink.
So that's a good point to make, is that the advice is not to use alcohol. The advice is to not use too much. Okay, so it's really putting a downward pressure on the amount that people are drinking. In fact, if you look at per capita drinking, the more alcohol consumed on average, the higher the mortality rate and morbidity rates. So where it really seems to make most of the difference is in older people who have multiple cardiac risk factors. So the person older than 50 or 60 that is smoking, has high cholesterol rates, high hypertension, high blood pressure, and so forth, diabetes, that kind of picture, that a little bit of alcohol has an effect, and whether it's on platelets or some other, or lowering blood pressure more than it was, or some other factor like that, because if you increase alcohol in other populations, there are other diseases and problems that increase. So it's not decreasing everything, it's decreasing some things and increasing other things. So like, so I always like to turn the question around and say, well, who would we advise to drink? Or who would you advise not to drink? So let's start with that. Well, certainly children of alcoholics, anybody with a family history, you wouldn't want them to try to drink in moderation because of their risk factor. Women of childbearing age, so we know that alcohol, even moderate amounts has an effect on the fetus. And how long does it take till you know that you're pregnant?
Several weeks.
At least a month or two, and that's the time when the embryo is forming, and it's the most critical. So anybody of childbearing age that's sexually active, you wouldn't want them to drink. Breast cancer is increased even with moderate alcohol use. So you basically taking all the women out.
So yeah, you don't want any women to drink.
How about young people, 15 to 25-year-olds? Well, the biggest causes of death in that group is accidents, suicides, and homicides, and alcohol and drugs plays a big factor in that. So you certainly wouldn't want to advise a young person to start using.
And all of those causes of death.
Anybody that has a medical problem, so you can hardly come up with a medical condition that isn't exacerbated by alcohol, high blood pressure, diabetes, insomnia, seizure problems, neurologic problems, memory problems, so GI problems, stomach problems, and ulcers, and gastritis, and heartburn. You wouldn't want to advise alcohol in that group.
And pancreatitis, and liver disease, and liver cancer.
People operating machines and heavy equipment, anything that would dull the reaction times and response times. Anybody that's driving. So let's talk about that a little bit. Even non-drinkers have a certain amount of accidents. And the point at which drinking increases the risk of accidents above that of non-drinkers is a little bit more than 2 drinks. So just a little bit more than 2 drinks is all it takes to where we see increased motor vehicle accidents.
And what level of alcohol in the blood would that be?
So that would be 0.05 grams percent, or 50 milligrams per deciliter. Okay? And in pilots, it only takes a little more than 1 drink to see an increase in accident rates. So the more technical and detailed the task is, then the less alcohol it takes to impair that. So even a drink or two will impair us. The question is, well, if we're not doing anything that's big a deal, then we sort of seem like we get away with it.
But then people apply that same thing to the drink that they had. It didn't affect me. 1 or 2 glasses didn't affect me, and yet they've got these alcohol levels that are very clearly shown to cause increase in accidents, which is a level below the legally drunk level, right?
Well, part of what you referred to initially was if a person has a family history of tolerance, if they have a family history of, there's actually genetic reasons for seeming like you can handle a certain amount of alcohol. So this is where early on, in the teens or the early 20s when they first started using, it looked like it took more to get an effect, or they thought they were kind of proud of the fact that, well, I'm not that affected by alcohol. So they could put away several drinks and another person's fallen asleep at 1 or 2 and they feel fine. So it's that kind of person that's actually at a higher risk for developing problems because they can't recognize it.
You talked about the genetic factor. Has that something that's been relatively new in the scientific community, or has genetics played a part and been known about for many years?
Well, the pendulum has swung. So if we look in the 1800s and before, people thought everything was genetic. And then when we found out the actual mechanism of that, then the pendulum swung the other direction to thinking that nothing behavioral or emotional was inherited. And so now it's not an either-or question. Just like cancer, it's not either-or. It's not only environment. It's not only genetics. It's how our biology interacts with our environment. And so it's all of the above. So some people can have a stronger genetic predisposition, and other people, maybe it's a more psychological. I have had some patients who intentionally were drinking to get drunk from age 10 because of the stressful, abusive environment they were growing up in. And others, it's more of a blend. So there's also been twin and adoption studies that have looked at identical twins, one brought up in an alcoholic home, the other in a non-alcoholic home, and regardless of where they were brought up, if they were born to alcoholic parents, they developed alcoholism in a highly correlated fashion. And so clearly there's a genetic component that's not contested anymore. Doesn't explain everything. And there's a lot of people that have perfect environments, perfect childhoods, perfect upbringing, that just the exposure to a chemical and to alcohol then will put them at a risk category that will eventually develop problems. Doesn't mean, so I don't want to come across as saying one drink is going to make you an addict. Sure. Some people get away or drink truly socially for decades, and then when they retire and get a little bored and so forth, then their drinking increases. Others early on, and some, I believe, some drink truly socially lifelong and never get into problems. Though the issue there is you can't predict. So so the question is, how close to the edge of the cliff do you like to live your life? Are you the type that likes to live 5 miles away, or you like to live 1 foot away? So everybody gets to make their choice on that.
Sure.
One of the things that we've talked about and skirted around a little bit is the idea that morbidity is a different type of outcome than mortality. Now, morbidity is not a term that we hear a lot, but what it means is an illness that doesn't cause your death, at least not right away. And a lot of statistics that we see are relative to the mortality, like the mortality from cardiovascular disease seems to be a little better if you take 1 drink a day, but that seems to be 1 or 2 drinks. That seems to be more the older people, like age 50 and above that you were talking about, and certainly doesn't apply to these other groups, the younger groups and so forth. But I'd like to address a little bit more particularly the idea of the illness or the morbidity problem that alcohol can cause that you never hear about really much in these reports that come out across the media. Tell us a little bit about some of those problems. We've alluded to some of them, but the all-cause morbidity, I wish we had a figure on that, and that's a tough one to get.
Well, let's just kind of brainstorm together on just what we see in our day-to-day practice. We can start, say, from the top. What are the things that we see? Well, let's start psychiatrically. 90% of people that use substances in a problematic fashion will have some psychiatric symptom. So it could be depression, anxiety, could even be to the point of hearing voices, if we look at drugs in general, speed and cocaine. Trouble sleeping. All of my patients have trouble sleeping, so insomnia. Certainly seizures and epilepsy and convulsions can be caused by people trying to withdraw or by using stimulants. Neurologically, so then you can get memory problems and concentration problems. Strokes are increased
And that's
with
even
alcohol and stimulants.
Yeah, that's even on this 1 or 2 drinks a day, isn't it? That you can have an increase in stroke levels. I think I read about that recently.
So, yeah, I don't remember the exact statistics on that, but certainly at daily drinking, then, and you know, whether it's 2, 3, 4, certainly there's at the upper limits it's more clear. There's different kinds of strokes too. So the bleeding kinds of strokes or the clotting kinds of strokes, that there's a difference. Heart problems, so high blood pressure. So it's clearly a correlation, a significant fraction of people with high blood pressure.
Even on the low intake.
Yeah.
And also, I think irregularities like atrial fibrillation and other.
I had one guy that I think was having just a couple drinks a day that had enough premature contractions that we normally would have started medication. So I advised him about the alcohol, and he readily quit, and it cleared it up. Didn't have to be on any medication at all. So palpitations, certainly people with coronary artery disease that's active in angina, I don't think we would advise them it can cause flushing on the surface, but constriction on the internal arteries.
That's important to remember, isn't it? That difference.
So anything to do with the GI system, the gastrointestinal system, so heartburn, gastritis.
I'm sorry. What about women with breast cancer? Should they quit drinking, or once they've had breast cancer?
Well, even moderate amounts of alcohol increase the risk of breast cancer. So certainly, if they already have it, yeah, then they should stop.
And I think you mentioned earlier that women basically do have an increased breast cancer occurrence drinking even small amounts of alcohol.
Right.
So we wouldn't want them to be drinking either.
We know of no safe levels for anybody that's pregnant, so we don't know if there's a safe level on the fetus.
Right.
And it certainly is the most important in that those first 2 months, first 2 to 3 months.
I'm glad you brought that up again, because I've heard clearly from studies that even 1 drink of alcohol taken at the right time during pregnancy can cause these fetal alcohol effect, at least, if not the fetal alcohol syndrome.
Probably not the syndrome. You'd have to use a fair amount to have the syndrome, but effects is a lesser degree.
And when I heard this reported, it was followed on up into the grade school, and they found out that women who were taking 1 drink a day, even and if at the right time of pregnancy, the IQ of the kids had dropped. I thought that was rather astounding. This was some work done up in the Northwest, and someone who had spent a good share of their life studying it, one of the professors there. And that was rather astounding to me. Pretty scary, actually.
Yeah. Yeah, I mean, even like cigarettes, say even 1 cigarette alters the nerve cell permanently. And so on the one hand, I feel a little cautious. I don't want to come across as alarmist or overstating things that, you know, like we've grown up for a lot of us, that, oh, 1 cigarette is going to kill you and one drink is going to make you an addict. So we don't want to overstate it, but I think it's important to realize how small things start. I mean, we certainly have that concept when it comes to infections, that it can be just a little bit of a bacteria, a few viruses, and that's all it takes. That's how it starts. So on the one hand, we don't want to be alarmist. On the other hand, we don't want to be cavalier about it too.
Well, and I think the problem is that, at least it appears to me, correct me if I'm wrong, but most America is pretty cavalier about the whole alcohol situation, because it's part of the social kind of thing. People drink when they go out to eat and so forth, and they just don't think anything about it. And yet, when these things start piling up and up and up, and you hear all of these illnesses that are aggravated or caused many times by alcohol, you start wondering whether it should be used at all.
Well, it's pretty ingrained in our culture, and like with medications, it's a solvent. Things dissolve well in it, and it's readily absorbed. So if you have a vitamin or some other active ingredient that you want to get into the body easily and readily, then it's a natural vehicle. And there's some biblical verses that it seems like it's okay as a medication. And so, you know, we say, okay, But I have had some patients also relapse on even the small amounts in cough medicines. So I sometimes feel a little picky when I bring this up, but based on, I'm passing on the experience of other patients, that sometimes that's all it takes.
We've talked a lot about how it affects us personally if we're drinking, but what we haven't had time to talk about is how it affects the innocent people and how many car accidents there are where innocent people are killed because of a drunk driver, and abuse in the home because of an alcoholic parent, and elder abuse, child abuse. And our society, I think, is just starting maybe to have more laws and more discussion about the effect of what drinking does to the innocent people.
Well, certainly there's, I allow everybody a chance to learn by experience, and that comes to even, when we're younger and inexperienced with the use of alcohol, of trying it and going overboard with it, and then learning from that. Saying, well, I drank too much, I threw up on my date, I knocked over that mailbox. Okay, I shouldn't do that anymore, and they don't. So a lot of people are able to learn from it. But when that becomes repeated, they're not learning from it, that's then, as an addiction expert, that I say, well, there's something more that's going on that needs to be addressed. I think we'll always experiment is the problem. So.
Yes.
Yes.
Well, we need to have some kind of outcomes for these kinds of activities that young people engage in and so forth. They need to be held responsible. And I think the message from today is that be careful in what you do to your body. It's a God-given, God-ordained, healthy body when we start out, and we need to do our part to keep it healthy. And our prayer for you today is that after having listened to our program, you'll find many things that can help you and your friends and your family to stay healthy. And remember that text in Scripture that we love, Proverbs 17:22, "A merry heart doeth good like a medicine." We want you to be healthy and happy, so we trust that you'll apply these principles to your living every day, and that being truly healthy, wealthy, and wise will be the outcome. You're watching LLBN TV. Look us up on the web, www.llbn.tv. Tune in again next time for Healthy, Wealthy, and Wise. We hope you'll be listening. And tell your friends to listen also.